Hello, brain shakers, and welcome to this episode where we continue looking at contraception. In this episode, we're going to be looking at the cervical secretions, or how you can use the cervical secretions to determine the period when you are fertile and when you should obviously avoid a sexual intercourse if you want to try and use that method as a way of contraception or preventing pregnancy. Now, cervical secretions are something that you will need to understand. Now, before you even get to understand these cervical secretions, it means that you need to actually be checking your cervical secretions. Now, when we're looking at the cervical secretions, you are going to have periods when you will have what we refer to as the dry days. It means that there's not going to be any cervical secretions that are going to be present. So it means that when you go and check the cervical secretions, or you want to try and get through to the cervix to see if there are any secretions, you may not notice anything. So it means that those are your dry days. In your dry days, even if you have sexual intercourse, the chances of you getting pregnant then are going to be very limited. Why? Because the cervical secretions do play a key role in facilitating the movement of the sperms to get through to the egg or the ovum and then be able to fertilize it. But that is only going to obviously happen if your cervical secretions have started becoming a little bit light. So it means that they have to get to a stage where they are wet, clear, and stretchy. So you notice that you have a dry period from about day 6 to about day 9. And then from there, then the secretions begin to change now, and they're moist and white and very sticky, meaning that they are thick. And during that time when they are thick, it means that it is going to be hard for the sperm to then penetrate and get through to the ovum. The sperm has to wait until such a time when you have wet, clear, and then you have that stretchy kind of cervical secretions. And that is only going to happen somewhere around day 12 to about day 16 or so. So it means that you're already moving towards that 14-day mark that we said is the time for ovulation, or the time when ovulation does happen. So it means that the change in the consistency of the cervical secretions then is what is going to determine when you're most likely to be fertile, and also when pregnancy is most likely to occur. So what we are saying is that once you notice that change from the white and sticky cervical secretions to now getting into wet, clear, or egg white, that you would notice, that is how it's basically going to appear. That is a stage when you are then at peak of your cervical secretions, meaning that the chances of you then falling pregnant around that time when you notice those secretions are then going to be high, meaning that that is the time around which you should then avoid sexual intercourse. That means that around day 9, you'll be avoiding sexual intercourse from about day 9 to about day 18 also. Once you have done that, it